All right, Adele, as promised, here's my attempt to summarize the results of one of my recent research papers to the tune of a nursery rhyme, like you did earlier in the week for your social media and back pain paper. So the paper I'll be talking about today, published in Musculoskeletal Science and Practice earlier this year, is Why is Exercise Prescribed for People with Chronic Low Back Pain? A review of the mechanisms of benefit proposed by clinical trialists. Like yourself, I'm going to do this in a couple of different sections, but each section is going to be to the tune of a slightly different nursery rhyme. So the introduction will be to the tune of Old MacDonald, the methods to Itsy Bitsy Spider, the results to Twinkle Twinkle, and the discussion and conclusion to Old MacDonald again, because I don't know that many nursery rhymes. Here we go. Low back pain's the leading cause of disability worldwide. Exercise has been shown to help and is recommended by guidelines. But exactly why exercise works, no one fully understands why. So in this systematic review, the proposed mechanisms were synthesized. We performed a review of trials in Pedro of adults with low back pain who go fitness training a go. The mechanism proposed by trialists for why exercise is great were extracted in duplicate into a red cap template. The data were analyzing quantitative and qualitative means. We counted the number of times each unique mechanism was seen. For qualitative analysis, the mechanisms were grouped into themes, and then we met to discuss the results to find out what it means. 110 trials were identified, with union multimodal interventions both applied. In terms of the mechanisms grouped into themes, neuromuscular and psychosocial were the most commonly seen. The themes identified less frequently proposed were cardiometabolic and some related to blood flow. The results of our review found a few interesting things, so you should keep listening to find out what they mean. The first was that a third of the time no mechanism did exist, which goes against the recommendations of the consort checklist. The second was that the mechanisms proposed are highly varied, but biomedical and psychosocial mechanisms seemed quite common indeed. With a muscle strength here and a motor control there, fear avoidance, gait control, many things may play a role for people with low back pain who improve after exercise. The results of our review might help us better understand why. Alright, I've spent too long on that today, so I better get back to other things.